This is a new era of healthcare for older populations. Care coordination provides flexible, all-inclusive care for seniors. It focuses on maintaining and improving a senior's health according to their needs. The focus is on wellness, early prevention, disease management, continuity of care, and quality and dignity of life.
Well, Betty came to me with the passive enrollment, so our relationship has been going on almost 2 years now. And she was one that was a community member with services, so she came to me with a name, phone number, and so I started from there. She's one that had diabetes, unmanaged. She's not very compliant herself. She has her own home remedies that involve maple syrup. You know, if you wake up a little lightheaded, you just drink some maple syrup and bounce back. Well, that's okay for emergencies, but in the long run, it's a complicated disease that takes a lot of lifestyle changes. It's not easy to do by yourself when you're in pain and have arthritis. Telling about how well your dialysis. We looked at past labs, and here we found she had kidney function of 15 to 17%. So she was right on the line to be starting dialysis and had no clue about what was coming ahead. When you meet her, you don't even see her as somebody that you would think is 80. Her perspective is very youthful. She could easily pass for 58, 60. We have our own little introductions when we contact each other.
What can you say when somebody's your angel? She's there. She always returns calls. She even comes to see me once in a while, which is nice.
She was meeting with the dietitian in the nephrology department, and just observing her across the desk, I just started beaming, and she interrupted her session and said, "What are you laughing about?" And I said, I am just like the happiest nurse in all of Minnesota right now, because I could tell that you read what I sent you in the mail. And her reply was, "Well, how could I throw it away when you wrote 'thinking of you' on the sheet of paper?" And it just made me realize the power 3 little words can have.
Jeanette helps with everything. I can't even count. If I had a paper, I would fill up pages and pages like this of what she's helped me with. And like I said, the most thing was the moral support more than anything else. So she's smiling back there, isn't she?
There is a magnitude of support behind the care coordinator. An interdisciplinary team assesses the needs of seniors, creates care plans, and delivers services. There is a network of relationships that facilitates comprehensive care, which allows the senior to live as well as possible. The care coordinator is supported by an integrated healthcare system. Elements of this include technology, physicians and nurse practitioners, equipment specialists, and therapists, and partnering healthcare facilities. What makes care coordination work is our ability to expertly assess patient needs and deliver best care, supported by the most up-to-date systems and technology.
Hi, this is Sharon Perrault. She's here to see Diane. Sharon Perrault, she is a delightful lady. She's had a very, very hard life, had to raise her children by herself. And she's a survivor, but she's to the point right now where she has got some medical issues and some housing issues that have really brought her down. She is recovering from a colon cancer, and she has severe osteoarthritis and dealing with a lot of family issues, some chemical dependencies. But she's a great person. She's warm and she's very giving and she's very caring. She would do anything for her family, even though she can barely walk. I could hear her when I knocked on the door for her to let me in. She had to come down from her apartment, and it took her 5 to 10 minutes to get down those stairs, and I could hear her just moaning and saying, "Oh, this is so painful." And so, right away it kind of gave me a clue that, this living situation is not working for her. I hadn't even met her, and so I thought, if she could be in an assisted living facility where she would have an elevator, not having to go up and down stairs, it would make her life so much easier. And then also I could assist her with the public housing to help her get some financing for that. And so Sharon was so excited, and she said to me, "Well, I've always wanted to live in Gateway Tower, but I have not a clue about how to go about getting the paperwork, or I don't have the transportation to get down there." And so I said, "Well, Sharon, I can help you with this." And so we were able to get her moved in tonight and get her settled into Gateway Tower. And she is so happy there because now all she needs to do is take the elevator. Her apartment is probably 10 feet from the elevator, so she doesn't have to walk very far. And when we meet these elderly people, 9 times out of 10 they don't have family. Sharon was really blessed because she's got an awesome family. That's what we're trying, is to really improve the quality of life for these elderly people that are so disadvantaged. And so what our program is doing is that we're really reaching out to these people that society kind of has closed the door on them. And so we are able to show that, hey, somebody cares.
And how wonderful as a nurse for me to say to an 80-some-year-old, I can invest in you. Your insurance has these benefits. I'm here to tell you what your benefits are, and you're worth the investment.
Is that I feel like I'm really helping people, not just medically, but just to change their life. And I have found that once we get the housing issues out of the picture and they're comfortable in their living setting, then I can focus on the medical issues.
I see a lot of beauty in this care coordinator role because we know them more intimately in that sense, from their environment to stories they've told us to seeing how they actually function in their environment. Where the doctor, when you're looking at a 20-minute or 40-minute consultation, there's just no way you would have time to even look at that level of detail.
These 2 stories represent the stories of thousands of frail seniors living in the Northland, but care coordination has made a meaningful change in the health care they're receiving. Essentia Health and the Benedictine Health System are working together to explore more care coordination opportunities to bring patient-centered care to the communities we serve.